My next question is for Representative Adam Smith. So, societal level interventions, such as reducing stigma and discrimination, which we've talked about, tackling poverty, and ensuring access to housing are all vital elements in improving mental and behavioral health outcomes. So, how are societal level interventions addressing mental and behavioral health being boosted at both the state and federal level?
Well, I think you've seen a lot of increase in fundings, particularly during the pandemic, for precisely those issues that you talked about. I mean, Congress passed somewhere around $6 trillion in supplemental aid during the pandemic that went to housing, education, transportation, a lot of those things to help people on the big, the most marginalized in our society, and make sure they had access to those things. I think the plan, the Build Back Better plan that President Biden had put forward, which would have really focused on, well, a number of things, but the one big part of it for me was childcare, universal pre-K for 3 and 4-year-olds, and expanded access to childcare. I think a lot of the basic mental health issues that people face start with children. I mean, basically, if you could do just one thing on mental health, it would be to raise children properly in utero to 3. Give them the basic developmental structures that are so crucial to brain development at that age, that puts them in the best possible position to succeed going forward. The studies on this are overwhelming. Early childhood development drives so much of mental health. And, are they getting proper care at that age? And universal pre-K would be enormously helpful with that, as well as the expanded child care. Some years ago, we did pass, the mental health parity bill to try to make sure that mental health care was being covered on the same level that other health care. I also want to give a particular shout out to community health clinics. I mean, access is such a big deal for people, given the difficulty accessing insurance. Community health clinics do a great job of reaching out to Medicaid patients and to patients who can't necessarily afford care, and they're in the community where people can relate better to them and get access to them. And you'll also notice a lot of the community healthcare clinics now are greatly expanding their behavioral health services that they make available through mental health professionals. So I think that early development and that access to care, a lot of the money that the federal government, and I know the state government has done as well, to increase that access is one of the most important things we can do. And then, of course, last thing I'll say about this is universal access. I started out my talk talking about how back in 1993, we tried to do that in the state legislature. The Affordable Care Act made an enormous difference. 20 to 30 million people have access to healthcare now who didn't before, but we still don't have a universal access to healthcare system. People will, in addition to stigma and everything else, a lot of times people with mental health issues won't seek help because they don't have the money and they don't have access to the care. They don't have the coverage. So getting a universal access healthcare system nationwide would be a comprehensive way to make sure that we reach everyone who needs access to that care.